Hi, today I'm going to be doing an enema. I'm checking the order for it. My patient is Juanita Jenkins, and her date of birth on here is 9/14/79. There's no known allergies. The date is today. We're admitting a soap suds enema now for constipation. Okay, I'm going to start out by washing my hands. I'm going to go ahead and wash my hands. And then I'm going to get the empty bag. I'm going to turn on the warm tap water. I'm going to feel it with my wrist, make sure it's warm, not too hot, not too cold. I'm going to fill the bag with about 500 to 1,000 milliliters. I'm going to go ahead and put 1,000 milliliters in just to be safe. Okay? Then I'm going to go ahead and hang my bag. Once again, I'm going to check before I add the suds in. Again, my patient today is Juanita Jenkins, date of birth, no known allergies. She also doesn't have any remarks of glaucoma, any intracranial pressure, and there's no remarks of any rectal surgeries. Now, if she was a man, I would also check to see if there's any prostate surgeries. If any of those would be of occurrence, I would have to check with the doctor before going ahead and admitting the enema. And again, it's a soap suds enema for today, and the time is now for constipation. Okay, I have the soap suds. I'm just going to go ahead and put this in my warm waters that I made and get the solution ready. I'm going to go ahead and agitate the bag a couple times. Make sure it mixes. And I'm going to go ahead and open the clamp and prime the tubing. Okay. Okay. Now that I have all that done, I'm going to go ahead to the patient's room. Knock, knock. Hello, my name's Amanda. Today I'm going to go ahead and be doing a soap suds enema for you today. I'm going to go ahead and hang the bag. I'm making sure the bag will be no more than 18 inches above the patient's rectum. Okay, good morning. Can I have your name and date of birth, please? I'm going to go ahead and close the door and curtain and make sure the patient has privacy. Okay, Miss Jenkins, I'm just going to look at your ID and confirm that. And that is correct. Any allergies I should be aware of? None? Okay, I'm just going to ask you a few questions. Do you have any recent history of glaucoma? Any intracranial pressure? And have you had any rectal surgeries that are not in your chart? She answered no to all of them. Okay, we're going to be doing soap suds enema now for your constipation. And it is for today. I checked the patient's name, date of birth, and her allergies as well. Can you tell me when the last time you voided is? She says the last time she voided was 2 days ago. And can you tell me about what it looked like? What your bowel looked like? She said that her last bowel movement was 2 days ago, and she said it was darker brown and hard formed. Okay, I'm just going to go ahead and lay you flat. I'm going to put the bed rail down, lay the bed flat, and if the height was adjustable, I'd put it at waist level. It's comfortable for me. I'm going to go ahead and assess your belly. I'm going to go ahead and wash my hands and put gloves on. And again, the route for the enema also as well is of course anally. Okay, so I've washed my hands, put my gloves on. If I wanted to put a gown and goggles on as well and a mask during the enema procedure, I could. It's for whatever's needed, but gloves are needed. I'm going to go ahead and check your belly. Looking for any distension. I don't really see any. I'm going to go ahead and palpate your belly. Any pain here? No. Any here? Before I do the lower white quadrant, though, I would ask her if she was having any pain there before palpating, because if it would be appendicitis, that wouldn't be good. But she stated beforehand she had no pain. Okay. She says there's no tenderness or pain in her belly. Okay, can I please have you lay on your left side? So the patient's going to lay on her left side, flat. Okay, Miss Jenkins, I'm going to go ahead and put a pad underneath you to keep from your bed from getting soiled or wet during this procedure. Okay. And I put the pad underneath her. I'm going to go ahead and I'm going to lubricate the end of this tubing, and then I'm going to insert it rectally. Your mild cramping will be expected, but if you have any worse pains or really bad cramping, just let me know. Sometimes it's just a case of adjusting the bag. The bag can be 18 inches above the rectum. If there is some more cramping than usual or whatever, it's too fast, you can lower the bag, which will go ahead and slow down the stream and allow them to be comfortable, or I can clamp it off up here to give her a rest. If she's doing well, I can go ahead again and raise the bag, but like I said again, no higher than 18 inches. I'm going to go ahead and take my lubricant, and I'm going to lubricate about 2 inches of this. Okay, hun. And I'm going to go ahead and examine her rectal area, and I'm going to take the tip and insert it in her rectum, in her anus, into her rectum, towards the umbilicus, about 3 to 4 inches. Now I'm going to go ahead and keep that held in there, and I would turn this on and ask her how she's doing while it's going. And she says she's tolerating it very well. And I would just go ahead, stand here, hold this for her until the bag either runs out or she says she can't tolerate anymore. So she says she's about done, she can't tolerate anymore. So I'm going to go ahead and get a paper towel and pull this out, clean it, and wrap the top of this up. And I would just take this and dispose of it, making sure that my gloves don't hit the trash can. Okay, and then I'm going to go ahead and the patient can roll back over. I'm going to go ahead and give her her privacy again. I'm going to put the rail up, and I'm going to put her head up and sit her upright. Okay, Miss Jenkins, you just try to hold that as long as you can, maybe for about 5, 10, 15 minutes, but if you feel that you can't tolerate it anymore, you just hit this button and you call me in and I will give you the bedpan. Okay? Well, she says she can't really hold it before I can leave, so I'm just going to stay here, and I'm going to go ahead and lift her bum and give her the bedpan and some privacy. Bed's still in position, her head's still up. I'm going to give her the call bell, and I'm going to say, okay, you call me when you're done. I'm going to remove my gloves. If you do get up and go to the bathroom, please do not flush the toilet because I need to take a look at it. She's aware of that and she understands. If she's going to call me back in, I'm going to go ahead and throw my gloves away, leave the room. Say she calls me back in. Knock, knock. Hi. So you're ready? Close the door and provide privacy. Wash my hands. Any pain or anything while you were relieving your bowels? Patient states there is no pain while relieving her bowels. She tolerated it very well, and she is done. I'm going to go ahead and put my gloves on after washing my hands. Okay, we're just going to peek under here. to go ahead and take this, and I'm just going to go ahead, make sure the patient's clean. If they weren't clean, I'd go ahead and provide the perineal care and clean their underneath for them, make sure that's clean. And I'm just going to go ahead and remove this. And we'll dispose of this. And I'll give her back her privacy. And I'll ask her how she wants to set up. Okay. Any questions or concerns for me? No? Well, you did very well. If you have any problems, you just go ahead and you contact me. Thank you. You hit the call button. I'm going to pull the rail up and clean everything up. And then I would take this to the bathroom, wherever. I would examine the color, odor, consistency, amount, make sure if there's any blood or anything, and there is not, then I would go ahead, dump this in the toilet, rinse it out, dump it again, flush it, and then I would either dispose of this the proper way and the way it needs to be, unless it needs to be used again.